So the hip is really kind of complicated, and you want to think about it similar to how people talk about their shoulder. So there's little muscles in the back called your deep rotators that essentially hold your femur, big bone through here, help hold it in the socket. And if they're not working properly, what happens is some bigger muscles, like your hip flexors through here, they can go really tight to try and protect your hip in space. Now, if you do injure yourself, or you've hurt your glute, or you sit a lot, sometimes it's because of how we live, they can kind of shut down a bit, and then we get really tight through here. So a really simple exercise to start to make these work better is basically just doing some external rotations with the hips. So I'm sitting here with my feet like that. I can use both at the same time. So if, for example, I'm pregnant and I've got pelvic girdle pain, I'm loading both sides nice and equally. And what it does, by going out, I'm forcing those muscles to work, and I'm trying to do it nice and slow and controlled. If you watch my feet now, Christine, so I've just done like 2, and I'm moving into my 4th one. See, I can actually move a lot further. And that's because those muscles are firing better, which is allowing the muscles in the front to relax. So I'm actually getting more internal rotation of my hips, which is like really cool. So it's a nice simple one you can do that you can use to activate your glutes, and it should help muscles in the front chill out and relax to reduce any kind of like hip and groin pain.